Welcome, everybody, to this session of PlantPure Summit. It's co-sponsored by PlantPureFoods.com, and I'm your host, Ron Gandiza. I'm a member of the PlantPure Nation team, and I'm extremely honored to welcome our next guest, Dr. Kim Allan Williams. Dr. Williams was born and raised in inner city Chicago and attended the College of the University of Chicago, followed by the University of Chicago's Pritzker School of Medicine, internal medicine residency at Emory University, and overlapping fellowships in the cardiology at the University of Chicago, clinical pharmacology, and nuclear medicine. He's board certified in internal medicine, cardiovascular diseases, nuclear medicine, nuclear cardiology, and cardiovascular computed tomography. Dr. Williams also served on numerous committees and boards at the national level, including the American Society of Nuclear Cardiology, the American Heart Association, the American Medical Association, the American College of Cardiology, the Certifying Board of Nuclear Cardiology, and Certifying Board of Cardiac Computed Tomography, and the Society of Cardiovascular Computed Tomography, and the Association of Black Cardiologists. He served as the president of the American Society of Nuclear Cardiology and chairman of the board of Association of Black Cardiologists. He also served on the Cardiovascular Disease Examination Board of the American Board of Internal Medicine until 2012 and currently serves as the American Cardiology immediate past president 2016. And really, Dr. Williams has quite an extensive background, and you can read more about it on our website at plantpuresummit.com. And I first met Dr. Williams last year in Atlanta at the Food is Medicine conference, which was really where I was totally shocked at some of the facts and figures that he mentioned at that seminar, and I wanted to make sure we got that here in the PlantPure Summit. So thank you so much for joining us, Dr. Williams.
Thank you for having me.
Now, obviously, with your background in medical science, you mentioned that you're a vegan. And this has been mentioned in several places on the internet. You're very popular in the vegan world. What started you down this path? Were you vegan before you became a doctor, or was this something that you jumped into afterwards?
Actually, I was doing what we thought was a very heart-healthy diet: chicken, fish, no red meat. Turns out that that's more of a cancer prevention diet if you look at the data very carefully. And it turns out that chicken and fish, if you just Googled the term cholesterol content of foods and put in salmon or put in chicken breast, you find that you're actually eating more cholesterol per serving than you would be if you were eating pork chops. Not the saturated fat, admittedly, and maybe not all the cancer-causing agents, but you're eating more cholesterol. So it turns out that as I got a little older, which most of us do, we ended up, you have a change in your metabolism, and what was an acceptable, reasonable cholesterol level became horrifically elevated. At the same time, I was not playing tennis twice a day anymore. As my oldest son aged out of playing national tennis tournaments, I was his coach. And it turns out that that combination of a little less exercise and a little more aging, the LDL cholesterol can just take off. And that's actually been noted in several studies that have looked at this. So there I was with an LDL cholesterol, wanting it less than 100, but it was actually 170. It was at the level where I was probably going to have an event in a few years, who knows. But I did have at least some idea that plant-based nutrition was out there, and right when I was thinking, I'm going to remove all sources of cholesterol and see what I can do just on my own liver production, I was actually very pleased to find that there was a wonderful article published just that same week in the Journal of the American Medical Association. It was actually the Portfolio Diet. This was published by David Jenkins at University of Toronto. And he talked about the effect of plant-based nutrition on LDL cholesterol and the other marker that we were so concerned about at the time, this was 2003, which was C-reactive protein. You know, you have people saying, oh, cholesterol doesn't cause heart attacks, it's inflammation. Well, the answer is it's both. And Paul Ritker at Harvard showed that very clearly, that they are complementarily, deleterious. That is, if you have both a high LDL cholesterol and a high CRP, you're actually in much more trouble than if either one of them is abnormal alone. Interestingly enough, the portfolio diet within a couple of weeks was able to take people who had those risk factors, both of them, and reduce them down to normal levels. And so I immediately adopted it. I did have a decrease in my C-reactive protein, but I had a dramatic decrease in my LDL cholesterol from about 170 down to 90.
Wow. Now, how long ago was this?
That was 2003, so it's been about 13 and a half years.
Wow. Now, I'm curious because, as I mentioned before to you, before we jumped on the call, that in the vegan world, you've been quoted quite a bit. You've got one quote that everyone shares because it's such an impactful statement. So I'm just going to read that here for you, and you can explain this. It says, you've been quoted as saying, there are two kinds of cardiologists, vegans and those who haven't read the data. Now, put some context behind that. What brought this about?
So, so first of all, the context is that that was totally tongue-in-cheek. I have to tell you that my colleagues in cardiology, it sounds like I'm throwing them under the bus. These are the most intelligent, hardworking, dedicated people I've ever been around. They have really dramatically improved the healthcare of the world, not just the United States, where we have had a decrease in cardiovascular mortality of about 50% over the last 3 decades. And that is because of the hard work of these people. Now, so why would I say such a thing? It actually was a challenge to us who do believe in plant-based nutrition based on evidence. And that is, since the publications are all going to American Journal of Clinical Nutrition. Sometimes they go to the Journal of American Medical Association, but there's not enough of them in the cardiology journals that my colleagues read. And so as it sounded like an insult to everyone for them not knowing, when it was actually a challenge for all of us who are into this area to spend more time, more publications, more research, more definitive documents, whether it's white papers or position statements, getting to the cardiologists who are at the precipice of being able to change a patient from someone who has multivessel coronary disease or peripheral artery disease, et cetera, to being on their way to healing. And so, yes, it was said completely in jest. However, there is a lot of meaning to it, and the meaning is kind of reverse of what you think. That is, the people who are vegans, the cardiologists who are vegans, have a responsibility to make sure that that data gets out.
Now, I'm curious, how many cardiologists do you, I mean, is it growing in terms of the number of cardiologists that are looking at this? And I know you said it tongue in cheek, but actually looking at the data that are taking a more
Yes.
active interest.
Right. I do have a faculty member who saw the quote, read the data, went vegan. So,
Really?
yeah, exactly. And so, because the data is overwhelming, let me give you one good example. And I don't want to say that this is an isolation, but JAMA Internal Medicine on August 1st, everybody should have seen this article if they haven't. Definitely showing that in long-term outcome studies, if you compare mortality, that is death rate, in people who are eating vegetable protein versus animal protein, the animal protein increases death. There were a few surprises in there. We all thought that processed meat, what articles from the same group a few years ago said, red meat kills you, processed red meat kills you faster. That was confirmed, but for cancer specifically, it turns out that eating eggs increased the cancer rate more than processed red meat. That was a surprise.
Wow.
Uh, the next one is that a lot of us in the plant-based area sort of wonder why it is that ovo-lacto vegetarians don't do as well as vegans. Well, it turns out that dairy increases heart disease but doesn't increase cancer. And so a lot of that mortality from that difference, that gap between different types of vegetarians is probably driven by the eggs, maybe even more, at least total mortality, maybe even more than the dairy. However, if you add it up, heart disease, cancer, and other, each one of the animal protein sources, whether it's chicken, fish, eggs, dairy, red meat or processed red meat, all of them increase mortality, and most of them increase heart disease as well. The last factoid from there is that the graph said that, oh, you get about a 12% increase in heart attacks eating fish compared to vegetables. You get about a 12, and that reached statistical significance. So we can take that as scientific fact. For eggs, it turns out that it also was a 12% increase, but it didn't reach statistical significance. And why was that? It's because there were less people in that group. Why were there less people? Because they'd already died of cancer, and dead people don't have heart attacks. And so it really probably explained why we've had such difficult time with eggs, particularly codifying the relation to heart disease. People were dying of other things before they could have their heart attack sometime. It still was a 12% increase, but at least there was room for question. On the other things for heart disease, there was no question. The animal protein increases heart attacks, cancer, and death.
Before I became a vegan, which really wasn't that long ago, I used to eat 3 to 6 eggs a day. And that was, being from Hawaii, we eat a lot of meats, but
Right.
eggs are very popular as well. And I actually meet a number of people today that say, I can give up a lot of things, but I really love eggs. Eggs is one of those things that people struggle to give up with, not as much, maybe as much as cheese at times, I
Right.
think, just because people keep saying it to me. Eggs, oh, I could give up everything but eggs. So uh, this is information I wish more people knew about, the dangers of eggs.
Well, I can say that I have a lot of patients who feel the same way, and I point them to. Uh, I play this sort of game with the computers. Since we all have electronic medical records, the computer's open in front of the patient, and I sort of turn the screen so they can see it, and I play a game called Vegan Blank. I go to the search engine, I go to images, and I type in vegan space, and you tell me what animal product you're going to have trouble giving up. I'm going to type it in and see what happens. And when it's eggs, there are a couple brand names out there. I don't use brand names in an interview, but if somebody does that, they'll see them. I've had both those products. They actually look like eggs, taste like eggs, and it's just plant protein. The plant protein that, by the way, decreases death, diabetes, stroke, hypertension, and heart disease. And
Yes.
so we enjoy playing that game. Sometimes the question is it's chicken or it's ham or fish, salmon. All of these things come up with this very rapidly growing sort of fake meat, vegetable protein industry. I know there are folks who are concerned about it because it's processed, and certainly when you process meat, your outcome is worse than when you don't process it, right? So maybe the same thing is true of vegetables. Being data driven, I can't find any of that data. The only data I can find is that when you cook tomatoes, you get more of the lycopenes out of it. When you process soy, you get more ability to absorb the protein. So I'm happy recommending that. I know, maybe a fresh fruit and vegetable only diet is somehow healthier. I'd love to see that data. So I'm challenging the vegan community to come up with that, so that people won't go to the different fast food restaurants and order the veggie burger if it's not healthy. I'd love to have some data on that. But I do have data on the alternatives. The alternatives to, vegetables are starvation and animals, and we know that neither of those is a good option. So we go with a full plant-based diet until we have better data.
I'm thinking some of our doctors will take you up on that. We have quite a few on whole food plant-based, of course, meals
Yes.
and promoting the whole food plant-based diet. Now, I'm curious, as you mentioned this with doctors and talking to your colleagues, what are some of the pushbacks when you've heard about embracing a plant-based diet or plant-based nutrition and integrating that within the medical community, from your colleagues?
Well, it's interesting that there usually are not scientifically based pushbacks. That is, you hear things from one particular cardiologist who, again, I won't mention the name, but he was into paleo diet. And then we've had discussions with the lead author on the Mediterranean diet and lead author of the South Beach diet. They actually have data, not paleo, they don't have data, but the others have data that they improve cardiovascular outcomes. But when you are talking about the leading cause of death in the United States, a 37% reduction is absolutely fabulous with a Mediterranean diet. However, it's not elimination, it's reduction. Okay, and if you look at the work of Esselstyn, Ornish, we're talking about, essentially eliminating events if someone was able to adopt this and stick with it. And so I would like to see much more in the way of comparisons that are done in large free living populations to say that some of those non-vegan healthier diets are actually the way to go, because I think as long as they contain the animal products, they can lower the rate of death and disability, but they're not going to eliminate the foodborne illnesses that we're up against. So that's one, is that there are other diets out there.
Mm-hmm.
The next pushback that we get is practicality. And that's when I start doing vegan blank. Practicality in this country is really not a problem. You could actually have your entire American diet. Let's cut the fat, let's cut the sugar, okay? But the elements of the American diet can all be pretty much replaced. I did have one lady ask me for possum, couldn't find possum. Okay. And one asked for bison, couldn't find that one either. But this week, someone asked for kielbasa. I wasn't exactly sure what that was because I hadn't been a meat eater. I now know what it is. And sure enough, there's a brand out there of vegan kielbasa.
I've had it.
Calamari. Really? Okay. Typed it in. Sure enough, it came up. And so you can order all these things, and it's just plant-based protein. So I don't buy the practicality. Another one that I hear a lot is expense. And again, I don't do enough going to the meat aisle to compare ounce for ounce. But I can tell you that the best answer for that one is just to reduce the volume of food that we're eating, there's a fairly good amount of literature on that. That is, starvation proteins are actually cardioprotective. If people would go 14 hours without eating every day, they would do actually better. Certainly for people, and you may have heard on the news, there's growing concern, no pun intended, about the obesity epidemic in the United States, and that 2015 was the first year in quite a while where cardiovascular mortality did not go down. And that probably is the reflection of obesity and diabetes starting to catch up to the hearts of Americans. And so eating less is probably a good answer. So I always snap back with that one. Well, if you cut the number of calories, you're not spending as much money either. So the last argument is availability. And I am from the south side of Chicago in the inner city. I did live in what's called a food desert, where there were no large chains very close to me. I mean, you get on a bus and go get some food and come back and,
Mm-hmm.
drag the bags. But that food desert concept of poorer communities not having large chains with good fresh fruits and vegetables as options is a major problem in the United States. And hopefully, folks, that's on people's agenda enough to try to change that. So hopefully availability is not going to be maintained as a major contributor.
And I see that as well. Obviously, with PlantPure Nation in the film, we mentioned food deserts and having a PlantPure Oasis program to service those needs of communities with low-income neighborhoods where they just don't have access to fresh produce as much as other areas may have. And there's actually a concerted effort, not just with us, but other organizations to bring their produce. So hopefully that keeps growing, and that's the movement to make sure everybody has access to more whole food, plant-based resources and meals. Now,
Right.
you mentioned the pushbacks. I'm curious, with your background in working with so many different organizations, as in your bio, you've really seen the growth, if you will, of this movement, and also seen the other side and seen the pushback from doctors. But in terms of healthcare systems, complete systems, Do you see more systems coming on board and adopting plant-based nutrition or lifestyle, or even before you answer the question, because you hear that lifestyle versus plant-based nutrition, and sometimes it's used interchangeably. What's the difference? Because I hear lifestyle medicine being coined more, but I know there's a pretty big difference, isn't there?
So in my view, there is, but of course I didn't coin either term, so it may not be up to me to define them. But I would say when people are talking about lifestyle medicine, and when I attended the American College of Lifestyle Medicine conference, there were fantastic. I was speaking about diet, but the speaker before me was talking about lead in the water in Flint. There are issues that are environmental, social habits, whether it's drinking and driving versus smoking in public places. There's so many things that we could do to make the health of the nation better, and diet really is just one of them. I think that in terms of quantitation, diet is the number one. It has to be considered the main element. But the fact that there are so many people who have sedentary jobs and do not exercise every day, people who eat more than they should and they end up with being overweight. I'm sorry, that is a dietary issue, isn't it? But lifestyle is a lot of things, not just the content of what you eat, but how much and what other habits you have. Um, you know, I've been into healthcare disparities ever since my first conference as a cardiology fellow, where I went to the Association of Black Cardiologists and saw the data of how cardiovascular disease affects African Americans more than anyone else, and particularly African American men. And we've always had this gap, between the life expectancy of a Caucasian woman versus an African American man being 10, 14 years, and it varies year to year.
Hmm.
Well, last year, and when you talk about lifestyle medicine, last year was the first year that there was a huge decrease in the gap. And it was just startling to look at. And it wasn't that African American men improved that much. There was a little bit of improvement, steady improvement, but small. The gap was closing because Caucasians were dying, particularly in the suburbs, of opiate overdose.
Oh,
That is not how we were trying to close this gap. Okay, and so I tell you, lifestyle is a lot of different things. We need to get into the hearts and minds of people that enjoyment with substances, whether it's food, opiates, alcohol, uh, enjoyment with substances that cost you your life is not a price you want to pay.
now with lifestyle medicine, as I mentioned earlier, I've seen more and more schools, for instance, starting talking about lifestyle medicine, and I know a couple initiatives there, and more hospitals are mentioning lifestyle medicine, and as you mentioned, diet is a big portion of that. Lifestyle medicine, is that a better way then for those organizations? Maybe is there a stigma with plant-based nutrition and using that term, and where for those professionals that wanna, those healthcare professionals that want to introduce plant-based nutrition to uh, their organization, again, professional medical organization, should they? Do you think that's better to fit it in as part of lifestyle as opposed to just bringing up plant-based nutrition first?
Well, I think it's fairly complex and they're interrelated, and I think that if you are able to convince people to take stock of what the healthy habits are, and try to address them as a whole, at least it keeps us on the radar. If you look at the Life Simple 7, which is actually put out a few years ago by the American Heart Association,
Hmm.
and it's basically knowing your numbers. That is, what is your cholesterol, what is your blood sugar, what is your weight, what is your cholesterol, and then what do you do? Are you exercising every day? Are you eating a healthy diet or a lot of fast food, et cetera, high fat food? And then are you smoking? So those 7 things. When you ask how many Americans are scoring good 7 out of 7, it's 3%. 3%. Everyone else has one or more of those issues as an issue. And so I agree that we need to do more, and hopefully this is, like the American College of Lifestyle Medicine. Hopefully they are looking at how to change systems. I've heard of a few. I'm just a guy at a university hospital trying to change my environment. We do go out in the community and do health fair screenings. We go to churches. We talk about the Simple Seven, for example. But one place at a time may not be as effective as government agencies. So Michelle Obama has been on this fruit and vegetable thing for a while, and the fact that she's been able to rally some support, I think, has lifted the consciousness of Americans about this. And then on top of just getting the information out there, they're actually doing school projects. I think they were starting in Norfolk, Virginia. Not sure why, but I'm sure they had a reason to do that. But that was similar to a program that I heard about in Southern California not too long ago, where they were replacing junk food in the vending machines with carrots and celery. And the kids seem to adapt to having healthier snacks and seem to be doing better, everything from school to obesity. So this is the kind of thing that you'd like to see happen everywhere. The concerns are that there will be pushback, as you're concerned about, because if you change what's available without changing the culture, not having people understand why it is that it's good for them and that they want to do this, then they're unhappy. So that has been the pushback that I've gotten. Every place except Rush, by the way, that every place that I've been, I've tried to talk about plant-based nutrition with the hospital, and Rush was wonderful, as they have been about my community programs, very supportive. They actually put vegetarian options on the menu very quickly. It was a struggle at the other places that I've been, just because they were very concerned about how patients would perceive it. And and that's the question: do you give up market share because people are unhappy, or do you guide them down a path that is better for them? And that's a tough one as an administration. So that's a tough one.
I've heard the same with doctors who, even my own doctor, because I was very ill before, and really didn't mention a plant-based diet to me, even though I had symptoms, for instance, of prediabetes. So, and basically ignored it. I would literally say he purposely ignored it. And after I went plant-based, I actually approached him and said, "How come you didn't mention this to me?" I actually told him, because I had to find this out basically on my own. And
Mm-hmm.
he said that he himself felt very shy, if you will, to mention something because he isn't plant-based. So it's like a doctor smoking and telling someone else, "Hey, don't smoke. It's bad for your health." But the doctor himself hasn't given up meat in this case for us. So why should I give up meat if he hasn't given up meat if it's so healthy
Correct.
for you? Have you seen the same kind of um,
Absolutely. That actually generated that comment. That became so controversial about, two kinds of cardiologists. It wasn't just cardiologists, by the way. That's all physicians. But I can tell you, there was one other thing behind that, by the way, and that is we do have a plant-based nutrition diet group inside of our nutrition task force inside our prevention council at the American College of Cardiology, right? And that group really does have some very luminaries, all of whom you'd know, Dr. Esselstyn, Dr. Ornish, Dr. Barnard, but it also has a group of very vociferous plant-based cardiologists in it as well. And we are doing the right thing in terms of getting position papers out and getting them into the major cardiology journals, and we'll keep at it. But that group has actually tried to do a survey of cardiologists. And the survey actually said that 94% of our members who are highly educated had no nutrition information given to them from college, medical school, internal medicine residency, or cardiology, or afterwards. And so that is the reason that physicians struggle with it, is because they haven't been taught of that correlation. It would be great for them to, look at Michael Greger's stuff, and it was very eye-opening for me to realize that I'm just a cardiologist, but there are actually other major causes of death. And heart disease is number one, but if you start adding up 2, 3, 4, and 5, and you add them together, that's more than heart disease, right?
Right.
And so why is that all of these things are related to diet and nobody's paying much attention? It's an education problem. The plant-based nutrition has starting to make its way into the nutritionists and dietitians area and their knowledge base. Um, Historically, they talk about diabetes and they talk about how to control your weight. And I'm not sure they had all that much success with either one of them, but they would make some headway. But they wouldn't cure them. They would be treating them, right? Whereas plant-based nutrition has possibilities of actually curing some of these issues. So why not go in that direction? I'm hoping that we can get nutritionists, doctors, nurses, allied health professionals, everyone educated as to the power of plant-based nutrition. And if we can do that, that'll change the entire society.
That's amazing. You brought up a couple of big topics that I've seen over and over again, or issues that have been brought up, and feeling alone, almost where you have a number of doctors have come to us, even at PlantPure, seeing what we're doing, wanting to get involved with the movement. They watch the film, they've seen others, and they often feel like they're alone, like they're isolated. They think
Mm-hmm.
that, as you mentioned, you're in rush, and some hospitals are more open than others. And we've seen this, Lee Memorial in Fort Myers and Midland Memorial in Midland, Texas are very open. They're embracing it fully. And others, I see pockets of professionals that are wanting to get started. In fact, I was at the Peapod conference in Raleigh, North Carolina, and all dietitians with doctors, nurses as well. And same thing, a lot of these people were coming together and going, "Oh my gosh, I had no idea there was a growing organization, a group of fellow healthcare professionals, that are wanting to do the same thing." And it's getting the word out that they're not alone is
Right.
a big piece of that. Now, do you have a website or anything that you point people for additional resources to, for people who want to learn more about, do you have a favorite resource that you point people to who want to
Oh,
learn more
sure.
about?
So if it's a scientific person, a person who's a medical person, I always send them to Dr. Greger's website. Okay,
Nutritionfacts.org.
nutritionfact.org. Thank you. If it's and then After sitting and talking with Dean Ornish and Caldwell Esselstyn over and over and over again, I was trying to how do you choose between them? And I realized they're both right. So if I have a person with no disease but risk factors, or they have mild disease, I send them to ornish.com. Okay.
Right.
If there's a person that has critical coronary disease, the kind of people that um, you've gotten those dramatic results with a dramatic diet change that says plant-based nutrition with no fat that you can find, um, I send them to Esselstyn's website. And if possible, I send them to his course and have them learn to cook and learn to eat directly from Dr. Esselstyn. And so, I would say that I end up, because my practice is, sort of a lot of referrals from other cardiologists, as well as inside the institution. I do end up with almost, I would say, 60-40 Esselstyn, 60% and 40% Ornish.
Wow. And that's why I invited both of them to the summit as well. And to because of they have different approaches, but at the end of the day, they're steering people towards the same goal. Ultimately,
That's
it
right.
depends on what phase they are or what their condition is. Um, but it's something we're very cognizant about when we invited the summit speakers to have different approaches and for different people as well, to see what options are available to them.
Right.
Now, and this is my last question for you. Do you see the trend increasing, or what do you see? Put on your fortune telling hat right now. What do you see as the future? And if you can, give me some dates. Give me a
Well,
time frame. What do you see in the movement?
I would say a couple famous quotes. One is that the best way to predict the future is to create it. Okay. And so
Fair enough.
really trying hard while I have a little bit of recognition in the cardiovascular arena to keep talking about prevention in all aspects of it, but particularly about diet. As long as I'm a chief of cardiology, I'll keep bringing it up in our conferences. And we now have 4 vegan cardiologists on faculty here at Rush. And it's, it's just try to keep growing it one person, one household, one cardiologist at a time until we actually get somewhere. The other famous quote is the Schopenhauer idea about truth. That initially it's ridiculed, then it is fought against and very, very harshly, and then it's finally accepted as self-evident. And so we're not quite at that third stage of the Schopenhauer algorithm, but I say that we're actually in that second stage now. You hear a lot of pushback, particularly from industry. I don't know if you paid, you probably did pay close attention to the kerfuffle around the U.S. dietary guidelines for 2015.
Right.
They came out with a pretty decent report with one huge issue saying that American College of Cardiology said it was okay to eat eggs. We pushed back really hard against that. We did get that changed. The document now does quote what Neil Barnard had actually put from our committee. Our whole committee went after this to try to fix it. But he had pulled the quote from the Institute of Medicine, where people should eat as little cholesterol as possible, and that's now in the document. So that's a win. But we had some things that were not so much of a win. That is, when they say you should decrease saturated fat and you should decrease sugar, but then the original document said you need to cut out red meat, and then the follow-up, the final document, didn't have this as stern a warning. And when you take the sternness away, you can water it down a little bit. And of course, it got its 48 hours of fame, and then the dietary guidelines, who even remembers that they came out? And I'd like to see that remain evidence-based, be not influenced so much by industry, which is what happened. Everything from the beverage industry to the meat industry, the egg board, they were all trying to change the recommendations. And it would be great if we could somehow remove all self-interest. Good example, cardiology. It's completely against our self-interest to have people go on a vegan diet. Okay, our lifestyle might be a little bit better because there'll be less cardiac events to deal with, but our income goes plummeting. Okay, and so if you know when someone's telling you the truth, if it's not in their best interest to do so, and they're pushing it anyway.
That's great food for thought. That's great food for thought. In fact, you got me thinking about a couple other topics I'd love to talk to you more about. But I know we're just so happy that you could join us. As I mentioned in doing the summit, I want to tell you that as we were building up, and we built the summit in a relatively short time frame to start this, and I wanted to get a hold of you personally because I had seen your work. As I mentioned, I saw you in Atlanta for the first time, and it just shocked me what you said. And I said, oh my gosh, I wish more people, like everyone, had to hear what you said. Layman and healthcare professional alike needs to do this. So we'll do what we can to spread the word.
All right, fantastic.
All right. Thanks everyone for joining us here in this session of PlantPure Summit. And if you want to learn more about PlantPure Nation and information about what we're doing in the community, as you mentioned a few things earlier in this conversation, make sure you just go to plantpurenation.com and you can find more information there on all the different initiatives. And you can also check out plantpurecommunities.org, which is our nonprofit or a separate nonprofit organization that's doing a lot of great things in the food deserts with the PlantPure Oasis program. Again, thank you very much. Take care.